Access to healthcare is something many Americans find to be a basic human right. However, earlier this year, the World Health Organization estimated that up to 50% of the world's population doesn't have access to basic medical needs. Now, the healthcare industry is a booming industry because we are trying to bridge that gap and provide coverage for those that don't have any access while simultaneously improving the quality of care for those that do. Now, as I've researched the industry, I found a promising and innovative company that is providing life-saving access to some of the most underserved populations in the entire world. What we have here is not only an opportunity to invest in the booming healthcare industry of Africa, but to potentially save the lives of hundreds of thousands of people and create a lasting and meaningful legacy for our company. Now, in a study done by The Economist called the Access to Healthcare Report, they ranked the African countries against the other countries in the world in regard to access to healthcare. And what they found is that all but one country in Africa ranked in the lowest quartile. What this means is that Africans have some of the lowest access to healthcare in the entire world. Now, one of the largest at-risk groups is pregnant women. The maternal mortality rate due to postpartum hemorrhages ranges from 4 to 46% in the African countries. Now, compare that to the 2.9% in America. That's astounding. The reason for such high death rates is that these women don't have access to safe and available blood transfusions. Unlike America, 60% of their transfusions are on-demand requests from their relatives, and it's estimated that up to 25% of those donations aren't tested for HIV or other transferable diseases. Now, there is good news. Access to healthcare has been on the radar for many African countries. According to a report done by the Times of Africa, an additional 70,000 hospital beds, 16,000 doctors, 60,000 nurses have been deployed in Africa between the years 2002 and 2012. Now, the pharmaceutical industry has also been booming. There's been a $16.1 billion increase in net worth from 2003 to 2013, and it's estimated to be up to worth $65 billion by 2020. Now, this leads me to the company I want to talk to you about today. It's called Zipline. This is a groundbreaking company that centralizes blood donations and coordinates timely delivery to a localized region. They also do thorough screenings to make sure that the blood and medical material that they're transferring is safe and free of disease. So here's how it works. A local healthcare center can have their doctors, nurses, workers request what they need via text. That gets to the Zipline location, and someone in the center hand packs the order. They then send it on a drone, and it is flown to the healthcare center that needs it. Within 30 minutes it arrives and it drops the package that is attached to a parachute, and it gently falls down into the landing zone. It's usually on the roof of the hospital. From there, the healthcare worker will go up, they receive a text that it's there, they open the package, and once they confirm the contents, they send a text message confirmation back to Zipline, letting them know that it's received it. Meanwhile, the drone is on its way back to its home base, preparing for its next flight. Now, this method eliminates a lot of waste and underutilization of medical equipment and materials since it's delivered on demand. The drones are also available to arrive anytime in inclement weather, and they're not hampered by bad roads that happen a lot, particularly in a lot of African countries during monsoon season. Now, while they specialize in blood transfusions, the drone can also carry immunization, antivenoms, and other medications. Now, they currently serve rural areas of Rwanda. However, they have caught the eye of other African countries that want to expand on it and provide service to their constituents as well. All that remains now is one question. Will we choose to seize this moment? Will we invest in this company and save thousands of lives? Or will this opportunity pass us by? It's up to you.